Welcome to the Healthy Northeast Ohio Specialty Dashboards and SocioNeeds Index Suite tutorial. A dashboard is a collection of indicators around a topic, location, or other element. The Explore Data tab in the navigation bar contains several specialty dashboards, including the Demographics Dashboard, Disparities Dashboard, and the Healthy People 2030 Progress Tracker. In addition, it also includes the SocioNeeds Index Suite. This tutorial will provide you with more detailed information on each of the specialty dashboards and the SocioNeeds Index Suite on the Healthy Northeast Ohio site. To navigate to the specialty dashboards, hover over Explore Data, then Specialty Dashboards. Let's start by clicking on the Demographics Dashboard. The Demographics Dashboard allows you to view the most recent year of demographic data for your community, including population, race, ethnicity, age, sex, household income, housing, education, and employment variables. You can click on View All Demographic Variables to see a list of the 250 demographic variables available on the site. These variables are organized into tabs. Simply click on the tab you are interested in. This data is provided by Claritas and is available at the state, region, county, and zip code levels. To select a location, use the drop-down arrow. Clicking on a variable will take you to a page that includes a map and related chart. This map can be exported. Next is the Disparities Dashboard, which allows you to view the indicators that have breakout data available, such as race, ethnicity, age, and gender. This dashboard can be used to identify differences in health between groups and to help focus your program or policy efforts. You can select a specific location using the drop-down arrow. This dashboard can be viewed in the list or card view. The card view allows you to save the indicator cards as a JPEG. When you are looking at a chart, you can click the 3-line symbol at the top right-hand corner to download it as a JPEG, PDF, or CSV file. Lastly, the Healthy People 2030 Progress Tracker shows how a location compares to 10-year national objectives for improving the health of all Americans. These targets provide a benchmark for communities to work towards and can be used for setting goals. Select a location using the drop-down arrow and see how it compares to these national objectives. A red X icon indicates the target is not being met, while a green check icon indicates that the target is being met. If you click on an indicator, you will be taken to the indicator detail page. The Explore Data tab also contains the SocioNeeds Index Suite. This suite is another tool created by Conduent Healthy Communities Institute that provides analytics around social determinants of health to advance equitable outcomes. The suite includes 3 indices that summarize multiple health and socioeconomic indicators into one validated composite score to help identify and reach under-resourced communities. It is a tool for assessing, planning, and collaborating on community health improvement. The indices maps can help tell the story of a community. First, the Health Equity Index, formerly known as the SocioNeeds Index, is a measure of socioeconomic need that is correlated with poor health outcomes, including preventable hospitalizations and premature death. It can be used to identify areas at highest risk for experiencing health inequities. To learn more about the Health Equity Index, click on How Does It Work? All counties, zip codes, and census tracts are given a national index value ranging from 0, low need, to 100, high need. Then, those national index values for each location in a community are ranked from 1, low need, to 5, high need. You can view the Health Equity Index map or the table below to see the index values and rankings. The darker the shade of blue, the higher the relative need. If you click on a location in the map, it will highlight that location's row in the table below. To narrow your selection, use the filters above the map. This data can be downloaded as a CSV file by clicking CSV just above the table. Next is the Food Insecurity Index, a measure of food accessibility that is correlated with economic and household hardship. It can be used to identify areas in a community that are at the highest estimated risk for experiencing food insecurity. You can learn more about the Food Insecurity Index by clicking on How does it work? The darker the shade of green, the higher the relative need. The graph and table below the map lists the index values and rankings for the location you selected. This map and graph can both be downloaded. The data in the table can be downloaded as a CSV file. Lastly is the Mental Health Index. This is a measure of socioeconomic and health factors correlated with self-reported poor mental health. This index provides a visual of mental health in a community and can be used to identify areas at the highest estimated risk for experiencing poor mental health. You can learn more about the Mental Health Index by clicking on How does it work? The darker the shade of purple, the higher the relative need. That concludes the Specialty Dashboards and SocioNeeds Index Suite overview tutorial. We hope it has provided you with useful information on how to use the Specialty Dashboards and SocioNeeds Index Suite available on the Healthy Northeast Ohio website. As mentioned, please watch the other tutorials for more information on using certain features of this site.